I stay home a lot because I am a senior.
I coach tennis and I can't coach tennis now.
Every day, it's that isolation just sort of eats away at you a little bit more, and especially for those that were isolated before the pandemic, right?
Some people who are following this were getting ready, but I think the shoe dropped when the schools closed. And then it went downhill from there. Like, we need somebody to bring us pet food. We need somebody to bring veggies. We need someone to go get groceries.
Frankly, I just want to do whatever I can to help out.
We were doing research, and there was a need that we could address directly. We have all the knowledge, we have the connections. Let's just jump into it. The Friendly Neighbor Hotline, it's really meant to help address the issue of seniors that lack social support in TCHC building or a low income housing building. So, we were just thinking about these ideas and, we're trying to write it up and we're applying for grants to go into a testing phase later down the road. But, when the pandemic happened, we saw a chance to actually have a tangible impact with some of our research. We wanted to have a single number that a senior could call. They would be connected with a volunteer that could be their feet on the ground. In the first night, we got 150 volunteers. By the end of the weekend, we had about 300. Between last Monday and now, we've worked our way up to 600. So we're still vetting all of them. We have volunteers in all 25 wards, with close to 200 in the field. And just speaking with the references and hearing how amazing all of these volunteers are and how willing they are to step up in such a wild and uncertain time is amazing.
Well, I remind myself that the healthcare workers are putting themselves at much greater risk, and seeing the condition that some of these people are in. Honestly, ideally, I'd like to volunteer for somewhere between 8 to 12 hours a day, because that way I know I'm contributing something.
I saw them on Twitter and I started having a conversation. And from there, I got involved. I think my first conversation with them was how to do this in a very safe way.
When I deliver the groceries, there's a real attention to detail over the cost of each item and the examination of the receipt.
I live in TCHC and we have a lot of problems with predators. And what I didn't want was predators becoming volunteers.
Yeah, I definitely have sensed out, because I think they have to be so thoughtful about each item, and they're thinking so much into the future and how much they have and how long this could go on for.
And it's been worse out in my community. There's no toilet paper at all. There's no rice, no beans, no pasta. Everything we usually get is gone.
When the pandemic happened, it just makes worse a lot of these inequalities and a lot of these deficiencies.
The food bank in my building was a mess. Everybody was congregating out in front of it, and there wasn't much social distancing.
Sometimes people just casually walk past me, and mm, I could feel the adrenaline in my heart going up. I alluded to that in the conversation with the senior, and then the senior informed me that, well, some of these people don't have the internet, access to the internet, and some don't have TVs. So then that made me concerned for people in low income areas and the lack of information that they will receive.
I think Toronto, after we get a lull, has to really think about food security. The hotline is a great idea, a great template for future action.
At OpenLab, one thing we really believe in is, healthcare is public purse. So we try as best as we can to make all of the stuff we build and create public domain. We've been contacted by groups out of the UK, groups, out west, in BC and other parts of Ontario, and they can adapt it as they see fit.
Anything can happen in life now. We need to be prepared, and we're using the same old models, which are not applicable anymore.